So my name's Sarah Federin. I'm the research coordinator for the Division of Criminal and Juvenile Justice Planning, VOCA-SAC. I'm joined with our division administrator, Steve Michael, as well as one of our new hires, Tracy Lonigan. Tracy comes to us from the Department of Public Safety and has extensive knowledge on a variety of different things, but really specializes in UCR data. Anyways, Tracy's going to be one of our staffers who's going to be primarily assigned to this project, and she's already started to get her feet wet. So I'm actually going to turn the mic over her to kind of talk about our project and how we plan on doing things this year.
Hello. I'll just go ahead and jump on in. So for this particular project, we have two partners in addition to CJJP. We are working with the Crime Victim Assistance Division, which is with the Iowa Attorney General's Office, and then we're working with a particular program, Friends of the Family Rapid Rehousing Program. We are going to conduct a process evaluation, and in doing so, we're going to comprehensively examine and describe the current program and its adherence to the Housing First Rapid Rehousing Model. As a second part of that, we're going to complete an evaluability. I have a hard time saying that word for some reason. It doesn't really roll off the tongue very well, but evaluability assessment, which will identify currently available data, data collection barriers, and assist in the development of performance measures to better assess outcomes. It will identify potential data collection improvements and ensure the program outcomes can be assessed in the future. And this is all to say that the program that we are working with, Friends of the Family, this rapid rehousing program, has not been evaluated. This is kind of the first attempt at that. So before we can complete an outcome evaluation, we're going to do the process evaluation and then just see what data they have, what we have to work with. And after we do those things, we're also going to be completing a logic model. Friends of the Family offers rapid rehousing assistance to individuals and families impacted by domestic violence, and all of these individuals are at risk of becoming homeless. Friends of the Family serves individuals in 14 different Iowa counties. So individuals and families enrolled in the program meet with a caseworker for in-home visits to identify needs and barriers to maintaining permanent housing. Friends of the Family offers help finding safe and affordable housing. It also offers rent assistance. And one of the great things about this program is it also offers wraparound services, including employment assistance, child care assistance, mental health and substance abuse counseling, life skills counseling, transportation assistance, and support from other community assistance programs. So it really tries to meet the participants where they're at and just ensure that not only are their housing needs met, but that other needs they have may be met as well. We have two main research questions for this project. The first is, does the program adhere to the Housing First Rapid Rehousing Model? And if not, in what ways does it deviate and for what reasons? The second question is, what data is the program collecting now? And what data should be collected in the future to aid outcome evaluations? So far, we have written an IRB protocol. It has been approved. As part of that process, we also created drafts for staff interview questions. So all of that has been approved. We have obtained program materials. We've started to go through those, just kind of get a better understanding of what the program does, who it serves. We have completed a literature review with additional research conducted on the Housing First model and what rapid rehousing means in that context. And we are currently coordinating interview times with Friends of the Family so we can meet in person with program staff. We thought that would be maybe the most effective way to get some information, is to actually go there and have conversations with the staff. For next steps, we will be conducting those interviews probably in mid to late March. We'll then be analyzing interview responses, and in conjunction with program materials, we'll be completing that process review. We'll obtain additional information on data currently collected by Friends of the Family and see where there are gaps. And then we will complete the report and create a logic model by August 2019 and present our findings. So with this project, we are really just getting started. I think we kind of got started the beginning of January. So we're just laying the groundwork now, but we do hope in the next month or two to really get ramped up with this.
Excellent, great, thank you. Does anyone have any questions for our Iowa team? I'll go ahead and unmute everyone if you have any questions or comments.
Hi there, this is Elizabeth from Maine, and I'd love to ask the Iowa folks a few questions.
Sure. Okay, go ahead.
Thanks so much for sharing this. It's really interesting because I'm excited to see that there's some parallels with our project that you'll be hearing about next. And I just have a couple of questions about the counties that are the 14 Iowa counties that Friends of the Family is serving. Are those, close to Iowa City or Des Moines, or are they more rural?
I know that we have one of our program staff, Ben, on the phone. Maybe Ben could speak to that information a little bit more.
Yeah. Can you hear me okay?
Yeah.
Okay. So it's kind of a mix. Of those 14 counties, 3 of them have, for Iowa, I would consider bigger towns. That would include Waterloo, Cedar Rapids, and Dubuque. 175,000 people. The other 11 counties are rural communities. Some more rural than the others.
Got it. And just so I understand it, Friends of the Family is specifically their services are specifically offered to those impacted by domestic violence who are at risk of becoming homeless. And so is it a mobile program, or do they have offices in various places, or is there actual shelter?
Yeah, so we do have a 21-bed shelter that's located in Waverly, Iowa, which is just north of Waterloo, a smaller community. We do have some offices in the larger communities that we serve so that we can be mobile. First and foremost, through our funding with the state of Iowa, we're considered a shelter program, but we're providing the rapid rehousing up to 3 months of assistance on top of our shelter program, trying to keep people out of shelter and get them housed as quickly as possible. So yes, it's domestic violence. Our agency as a whole, though, also has 3 HUD contracts to serve just homeless individuals and families also. But this program is specific to crime victims.
Got it. And I think that was my only other question, but I will definitely look forward to hearing more. Thank you.
Welcome.
Okay, does anyone else have any other questions that they'd like to ask our Iowa team? Okay, I'm not seeing anything in the chat box or hearing any other questions come through, so we're going to go ahead and move on.